Chopra-Amiel-Gordon syndrome, or CAGS for short, also known as ANKRD17-related neurodevelopmental syndrome, is a rare genetic condition that primarily affects the development of the brain, eyes, face, and limbs. CAGS is caused by mutations in the ankyrin repeat domain containing protein 17, or ANKRD17, which is a type of protein structure involved in many cellular functions. Ankyrin repeat proteins have a unique shape that allows them to act like hooks, connecting them with other proteins to help in the formation of more complex structures. It is thought that ANKRD17 is involved in the development of blood vessels. Yet how the mutation in this protein leads to the clinical manifestation of CAGS is currently unknown. Most cases of CAGS come from de novo mutations, meaning they arise on their own and are not inherited. However, several cases of familial inheritance have also been reported. Typically, individuals with CAGS have unique facial features, which include a triangular face shape, high anterior hairline, low-set ears, a thin upper lip, and deep-set or almond-shaped eyes. Less common features include scoliosis and cleft lip or palate, which are openings in the upper lip or roof of the mouth, respectively. Individuals with CAGS also typically have varying degrees of learning disabilities and delays in reaching developmental milestones, such as sitting, crawling, and speaking. Additionally, they may have difficulties with tasks that require coordination and balance, like walking. Some individuals may experience epilepsy and have eye abnormalities, and there may also be neurobehavioral symptoms, like repetitive behaviors and difficulty with social interactions. Finally, children with CAGS tend to have feeding problems and frequent respiratory infections, which, if left untreated, can result in failure to thrive and decreased weight gain. Many of the symptoms of CAGS overlap with those of other genetic conditions, which is why diagnosis can be challenging in some cases. Diagnosis begins with a thorough medical history and physical examination. Blood tests can be used to aid in the diagnosis and to screen for comorbidities, such as infections. Imaging with a CT scan or MRI of the brain may be helpful in excluding structural defects and ruling out other conditions. Diagnosis can be confirmed with genetic testing, showing mutations in the ANKRD17 gene. Currently, there is no cure for CAGS, and treatment consists of surveillance and supportive measures aimed at improving quality of life and reducing complications. For example, surgery may be necessary to correct certain facial defects, including cleft lip or palate, in order to improve feeding and decrease the risk of respiratory infections. Bacterial infections can be treated with antibiotics, and seizures can be managed with anticonvulsant medications. Children with CAGS can benefit from early intervention programs to improve speech, communication, and motor skills. Finally, genetic counseling may be provided to individuals with CAGS and their families to help them understand the history of the condition and to provide psychosocial support. All right, as a quick recap, Chopra-Amiel-Gordon syndrome is a rare genetic neurodevelopmental condition caused by a mutation in the ANKRD17 gene, which is involved in many cellular processes. The most common signs and symptoms include unique facial features, learning disabilities, speech and motor skills delays, epilepsy, neurobehavioral symptoms, and recurrent respiratory infections. Diagnosis is confirmed through genetic testing, showing mutations in the ANKRD17 gene. There is currently no cure for the condition, so treatment focuses on supportive measures aimed at improving quality of life.
Helping current and future clinicians focus, learn, retain, and thrive. Learn more